Okay, we're going to start today's webinar. Welcome again. I'm going to share today's webinar. I'm Ernest Werner, Technical Director of the Barcelona DAS Regional Center. And well, we have today Dr. Pablo Mendez Lázaro coming from Puerto Rico, and he will overview the ongoing activities of the Environmental Health Department to implement mitigation measures in Puerto Rico for preventing the impacts of Saharan dust. So let me introduce our speaker briefly. Dr. Pablo Mendez Lázaro is currently an associate professor at the Department of Environmental Health of the University of Puerto Rico. It's a graduate school of public health, and he's an active member of the Puerto Rico Climate Change Council, and one of the 6 scientists nominated by the governor and the Senate of Puerto Rico for the Executive Committee on Climate Change Adaptation Plan. Also, Pablo is currently PI and co-PI on several NASA research projects, where he exploits new technologies in ways that benefits all segments of socio-ecological and technological systems by applying Earth observing data and remote sensing to research on public health and vulnerable populations. Recently, he has been invited by the US Global Change Research Program to serve as the chapter lead for the US Caribbean chapter of the 5th National Climate Assessment. So, Pablo, if you're ready, I'll give you the floor and we can start.
Thank you, Ernest, and thank you, everybody. Thank you for the organizers also and thus for inviting me to be part of this series of webinars. For me, it's an honor of being here. So thank you so much. I'm going to be speaking about 2 different research projects that we have in Puerto Rico that are sponsored by NASA, where we're working on Saharan dust intrusions and the impacts that it can have in public health, but also how can we use this information and how can we transfer this science and results into actions for decision makers, for practitioners, and for the responsible agencies to take actions when we are seeing this Saharan dust clouds arriving to the Caribbean. Okay, so basically I'm going to be speaking about the 2 initiatives that we have here in Puerto Rico. So back in November 2017, we submitted a research proposal to NASA Health and Air Quality Program with the idea of characterizing the distribution and pattern of Saharan dust using Earth observation data, mainly from satellites, obviously, and also in combination with the ground-based stations that colleagues in Puerto Rico have as well. And with that information, we wanted also to quantify the impact, mainly on respiratory diseases in Puerto Rico. That was our main idea, right? Using this information to develop or co-design a public health early warning system. This is important because most of the things that we're looking to be implemented by our agencies need to be science-based, right? So since the very first beginning, we have been using a human-centered design approach. And a human-centered design approach, this is a different kind of science or a different kind of methodology, if you want. When you start working with the people most affected by the problem to be solved, right? So it's a different approach. It's not the basic science that we are used to it to work. Obviously, we are doing, it's an integrative way of doing science, right? And to do that, we designed 3 different working groups. Let me see if I can move this, take this out of the way so you can also have access to the full screen. So the first working group was called, it is called, because we're still working on it, is Resilience, Public Health, and Well-Being. And this working group is the one responsible on analyzing and quantifying the impact of Saharan dust intrusion on public health using different kind of methodologies that I'm going to be explaining a little bit later. The second working group is called atmospheric forcing and air quality. And this working group is responsible of characterizing the particles that are arriving to the Caribbean, physical chemical parameters, and doing the ground, using the ground-based stations also to characterize these dust clouds. And the third working group is the one responsible of designing the decision support tool and the visualization tools for the agencies to use it as an information that can improve decision-making activities. So that's why we're calling it decision support tool. For those of you that are not aware, probably, and for all of us that are in the Western Hemisphere right now, so Puerto Rico is located in the Caribbean region. It's a small, literally, I think it's a very small island. It's only 8,000 square kilometers. We have 3.2 million inhabitants living in Puerto Rico, but 43% out of the 3.2 are living below the poverty level established by the United States. We are US citizens since more than a century, since 1917, and we have been part of the United States since 1898, although we were a Spaniard colony for 400 years. And so that's why another reason our main language continued to be Spanish. We have a few people living in rural population if we are using the census data from the United States, although the definition for rural population might not be applied that well for Puerto Rico. And in terms of race and ethnicity, as I explained, based on our cultural heritage, we are 98% Hispanic or Latino. So in comparison with the rest of the United States, if you want, we are the only territory that is only on 100% Latino as US citizens in the United States. Just for the local context, this is probably have nothing to do with the research, but because we might have people, international audience that would like to know where are we placed in the world, right? So who are we? We are a team, a multidisciplinary team of scientists. We have epidemiologists, we have people from atmospheric science, climatology, remote sensing, atmospheric chemistry that have been working together for the last 5 years almost in these two research. Okay, so we have 3 different institutions: the Medical Science Campus at the University of Puerto Rico, the University of the University of Puerto Rico in the Rio Piedras campus, and also the University of South Florida College of Marine Science in Florida State. Okay, so most of you are aware, and probably I'm preaching to the choir when I'm saying this. You've been attending to the INDUST webinars, so probably you already know this, but it's always good to provide this kind of information at the very first beginning. So over 20 million of tons are arriving crossing the Atlantic Ocean, transported with the trade winds from Africa to the Caribbean. So it's arriving mainly during the summertime, it's increasing during May and decreasing on August, with a few peaks during June and July every year. Millions of tons, okay? So in the Caribbean also, this dust is associated with an increase in excessive risk of emergency room visits and also increasing hospitalization, mainly related to respiratory diseases. On the other hand, we have the coronavirus, which is a new virus, but it's affecting also the same system. It's affecting mainly the respiratory system. And in some cases, the cardiac is presenting a cardiac injury. So, since we started in 2017, but then all of a sudden, and the beginning of 2020, the first cases of COVID-19 arrived to the Caribbean region. So we were wondering also, what could happen if we already know that Saharan dust is exacerbating the symptoms of patients that are having respiratory conditions in Puerto Rico. So what could happen if we have the pandemic arrive to Puerto Rico, and as it happened in different places of the world, it gets spread pretty easy and continue to affect the respiratory system. What will happen if we have 2 simultaneously events? One, a natural event, which is associated with a natural source of air pollution, and the other one, which is a pandemic, is a virus, both of them affecting the same system, okay? Again, I think that this is just because I don't know the profile of the audience, but obviously we have a couple of different sources for air pollution. And when we're talking about Saharan dust, This is our natural sources of air pollution. We can call it air pollution because if we're talking about public health, these particles may have a negative impact on the respiratory system and the cardiac system. But if we're talking, but it also can be considered that Saharan dust is also providing nutrients to some terrestrial ecosystem, marine and coastal ecosystem, right? So it's not only the negative component of the Saharan dust, but in the case, when we're in the context of public health, we're saying that it's a natural source of air pollution because it's deteriorating air quality. And this deterioration is representing a negative impact on public health. But also, these natural sources of air pollution are interacting with the anthropogenic sources of air pollution, such as transportations, industry, energy, and all of the others that could be present in a city or in our territory. So it doesn't mean that when these aerosols arrive to the Caribbean, that the local sources of air pollution are disappearing, and meaning that all of these particles are also interacting in the same geographic region, probably exacerbating the conditions for sensitive groups. What is the Saharan? The Saharan dust, and what are the seasons in the Caribbean? I already speak a little bit about the season between May and August. I'm going to be showing a graphic about that. But these are mineral dust particles that are arriving mainly crossing the Atlantic 7,000 kilometers away, and not only arriving to the Caribbean, but it could cross also the Central America, South America, and going to the North America. It depends on the season of the year, right? When we're talking about aerosol, it could be bunch of things like a piñata, right? And I think that most of you are aware of what can be present in this dust, in the dust clouds. So for example, it can incorporate dust, sea salt, volcanic ashes, for example, as well as smoke from fires and factory pollution in some cases. But it's mainly, when we're talking about the dust, are cores that are coming from the Saharan desert, lifted by the trade winds, but some specific conditions. For the wind to have the capacity to transport from one place to another, thousands of kilometers away, the sediments that are usually being deposited in the Saharan dust. Okay, so these particles, as I mentioned before, they can affect climate, atmospheric conditions. They can provide nutrients to ecosystem, terrestrial and ocean ecosystem, but also could represent a negative component for public health. Okay, the main season for dust clouds arrival to the Caribbean are during the summer season, so mainly beginning of late spring during May and reaching its peaks somewhere during June and July, depending on the year, right? And decreasing during August and September. Although we can receive, in some cases, off-season dust clouds. For example, we are receiving a slightly dust cloud. It's not that heavy, but in the Caribbean nowadays, we are receiving a dust cloud from the Saharan desert. And something that I would like to clarify, that I think that also my colleagues will agree on this. For example, we have been working, as you see, with Olga Mayol. She's the one responsible working with the ground-based stations. And the main sources providing this dust to the Caribbean are not necessarily the Saharan dust. It depends on the season and the year, but also the Sahel Desert is providing a lot of dust to our region. These dust clouds are associated also very intrinsic with the behavior and the seasonal patterns of PM2.5. So what we're seeing as well is that as soon as these dust clouds arrive to the Caribbean, the PM2.5 concentration also will start to increase. And this is because, as I mentioned, the local sources of air pollution not necessarily are disappearing when we are receiving this particles from the other side of the Atlantic. So on the opposite, they are interacting and in some cases exacerbating the conditions for air pollution. Okay, these dust clouds have impact on, as I mentioned again, in cardiovascular and respiratory conditions. In many places of the Caribbean, there's evidence that is associated with emergency room visits with children, associated mainly with asthma, Trinidad and Tobago, Guadalupe, and Grenada. In our case, we're using aerosol optical depth from satellites to corroborate this information. And the ground-based station it was the Environmental Quality Board that now it disappeared and is now under the Office of Air Quality in Puerto Rico, under the Department of Natural Resources and the Environment. In terms of satellite observation, what we're using to work on this, because as I mentioned, one of the main goals was to develop early warning system. But this early warning system need to take under consideration the sensitive group and the people that are most affected by this dust cloud. So it's not only an early warning system, atmospheric early warning system, but also considering that if there is people that is actually getting affected by this dust cloud, then our tool need to address that population. That's the target population. That's the message that we would like them to receive, okay? So we obtained different data sets in collaboration with the University of South Florida and the other colleagues that I already mentioned on who we are. So basically we have been working with VIIRS, which is obtaining aerosol optical depth daily since 2012 to the period 2020. To close the data set and the time series. Obviously, as you may know, VIIRS is not a geostationary satellite, so it's not providing, although it can have daily data worldwide, it doesn't necessarily provide daily data for one specific region of the world. So in our case, it's only, even though if it is daily, to cover the transports in the Atlantic Ocean, it's not necessarily providing daily data for Puerto Rico, but we're still using it. The other one that we're using also MODIS, and we're using ERA, and we're also using GOES in collaboration with NOAA. There are hundreds of different sensors up there, and most of you are aware. So we have the capacity, since we're working with NASA, we have the accessibility to all of this instrument. We are only using a couple of them. Obviously, not all of them are providing information about the aerosols or atmospheric conditions that we would like to analyze in the context of public health. So we're only using a couple of them, okay? And in the future, they're planning also to launch Maya and Tempo, which are going to be providing as well a lot of information for our region. So as I mentioned, we're using two different sensors. One that is geostationary, GOES, for example, that GOES have the capacity to provide information in a short period of time very often for Puerto Rico when we're talking about aerosols in the atmosphere. And the other ones are the non-geostationary that are orbital, which is VIIRS. But VIIRS is also useful because it's providing us information about the transport of the aerosols coming from Africa, okay? With that kind of information, we have been working with a lot of colleagues and almost 19 different organizations to start designing the first experimental decision support tool for the government of Puerto Rico. Something that I would like to clarify is that academia doesn't have the responsibility or the mandate to have early warning system. So what we're doing is making this information transferable for the local agencies, for practitioners to use it in an effective way so they can continue with their work and helping the community to be better prepared for this kind of hazards, right? So that's what we're doing. That's what we're calling it, again, decision support tool. It's not our responsibility to have an early warning system. We're only co-designing this information with the responsible agency. Just an example. And then the responsibilities are divided. For example, the agency responsible of monitoring the weather conditions in Puerto Rico is the National Weather Service. The National Weather Service is an office under NOAA. It's a federal office under NOAA, and is the one responsible of providing the best climate and atmospheric information in real time and forecast for the general public. But they're not responsible on providing information about public health, right? So we have been working with them in terms of how to communicate the issue of these hazards, but then the responsibility on how can this hazard be a negative impact on public health. We have been working that with the Puerto Rico Department of Health in collaboration with the Office of Asthma and Office of Public Health Preparedness and Response, okay? So it's a combination with the two different agencies, and we need to be coordinated. So we are using a platform from CARICUS. CARICUS is a Caribbean Coastal Ocean Observance System, which is another tool from, if you want, from NOAA that is under the University of Puerto Rico in the west side. And this organization is mainly providing support as well to the National Weather Service in thermoceanographic conditions, atmospheric conditions, and climate. So we take advantage of that and we create another collaboration. And we are using their existing webpage and tools to incorporate our information to make it accessible to their audience already that are using this kind of tools, and also to the other agencies that I've been talking about. So we are including information from VIIRS and GOES. Up until now, we are providing real-time information, or near real-time, because it's not real-time, but near real-time information, mainly, again, to the practitioners. This is not something that is still open for the general public. Our goal is, after we finish this year, probably to make it available, this tool, also to the general public. But up until now, the agencies are using it to make decisions and to inform the public of what could happen in the next couple of days and what are the local conditions in terms of the aerosols that are arriving to Puerto Rico. We have 4 different thresholds. So the higher ones, the mild, moderate, and low, okay? And each of the different categories or risk level have a message on how to protect yourself depending on the amount of aerosol that could be arriving to the Caribbean. And where I'm saying amount, again, we're using this aerosol optical test as a proxy, okay? We understand that this kind of information is not giving you the amount of the concentration of dust that is arriving, but it's a proxy, it's a tool, it's an experiment, it's a tool that can be used to protect public health. It's an effective tool, okay? So for example, this is a couple of examples of our tool being used by the Puerto Rico Department of Health and the National Weather Service. We're also working with them in designing infographics with messages, protective messages on how to react depending on the level of threat that we are seeing in our tool. Okay, so in the left side of the panel, what we're seeing are the infographic that we co-designed in collaboration with the National Weather Service, the 3 universities that I mentioned, and also the Department of Health. So the National Weather Service, for example, is already using this kind of infographic to inform the public, because again, it's not their responsibility to inform about public health. They only provide information about the atmospheric conditions and how these atmospheric conditions could be deteriorated in the next couple of days. But that's it. The other parts are from the Department of Health. So we're seeing here how we receive a dust cloud that arrived on October 3rd. The National Weather Service were using the infographic that we created. So in San Juan, it was said that it was very high, apparently the aerosols in the atmosphere. And the EPA was also suggesting right here that the air quality, it was also unhealthy. It lasted from October 3 until October 7. So as you can see, it's being used for many purposes. Now it's also, if you go into the webpage, please don't do that, but because it's only available for the end users. So if you go there, you have the possibility also to click in each of the different tachometers that are actually providing you the different thresholds that I mentioned. And you will see the graphic on the behavior and the patterns of the last year of the aerosol optical depth over Puerto Rico, over the 4 regions that we're using as proxies. And also, if you can click, and it can give you near real-time information. So if you are part of a sensitive group and you're actually being affected by these climate hazards, then you might use also this kind of information to protect yourself. Okay, on October 7, again, so the asthma office under the Puerto Rico Department of Health used and create this kind of infographic. We co-designed this information. So they use it and they are advertising and they are providing this information to the audience. As you can see as well, our tachometers were saying that the levels were orange, a little bit high. So an EPA in some cases of Puerto Rico as well, they were suggesting that they were also unhealthy for sensitive groups. And in the right side, you might see also the National Weather Service taking actions about and suggesting that the Saharan dust arrival were getting to the Caribbean. Okay. More recently, they using this information for also they continue to use this kind of information. So now in February 15 and 16, we are receiving another dust cloud. Sorry, this is not October 7. This is February 2, 2022. Sorry, I put here the wrong date. So these aerosols are arriving today into the region. Okay, so since yesterday, on February 15, the Department of Health start emitting or issuing or posting information about Saharan dust and public health and how to take precautionary measures for the audience. And then also did it in the afternoon. And I saw this morning that they did it again. And once again, they provide the same information. So as I mentioned, I'm only helping, we and our group, we're only helping the end users and the responsible agencies to have the best information available for them to do their job, okay? But it's not our responsibility to use this early warning system. We're only co-designing it for them to be used in an effective way, okay? On top of that, we have been also working with many others NGOs, because part of it is that we need to provide educational materials. And educational materials are not only necessarily creating infographics or visualization tools, right? So educational materials could be targeting different kind of audience. So we create an alliance with El Ecoexploratorio, for example, and we did a full week of webinars talking about Saharan dust and public health. And with the help of the Ecoexploratorio and one of our influencers locally here in Puerto Rico, we were able to reach over 400,000 people, educating about the Saharan dust, the different kind of tools, the methodologies, and the impacts on public health. And also with our end users, with the National Weather Service, we are still doing webinars for Saharan dust and air quality. And most of us, for example, in this case, also Olga Mayor, that you can see here, and myself, that are part of this research project, we are being part of this webinar. So we are trying to transfer this information as well to the general audience and to some other end users, not only to the National Weather Service and the Puerto Rico Department of Health, but so many other health clinics, hospitals, and physicians that are interested in these kind of topics. Okay, so the other part of this is to analyze the impact, right? And we also take under consideration the interaction with COVID-19. And so we started the first cases of COVID-19 arrived to the Caribbean region on, I think it was on March. I think that I have it in the other. Yeah, it was on March 2020, just a couple of months after they started in December 2019 in Europe and in Asia. It takes only a couple of months to get here to the Caribbean, okay? So after it closed, we say, okay, so we have a real issue here in Puerto Rico because most likely both of them are gonna be simultaneously during the same season, during the summertime. Because if it get here during March, the time that it takes to spread all over the population, we might be seeing an increase in cases and mortality in Puerto Rico during the summer in combination with the Saharan dust event. So to start working on that, we designed a couple of approaches. One of them was a cross-sectional study where we started working with qualitative instrument with physicians, patients. Why qualitative instrument in this case, not so satellite information? Because qualitative instruments are important. They can provide you vulnerability information, barriers, risk and perceptions of physicians, but also the patients who are the most affected by this problem. So we did interviews with almost 55 physicians and with 104 patients that were confirmed with COVID-19 during that period. In order to do that, you need to submit an IRB protocol. And the IRB protocol is the institute responsible, the office responsible of maintaining and keeping the ethics while doing research with human health, or with human subjects, right? and probably in most of your institution, you have the same thing. Another thing that we did is that we wanted to analyze the emergency room visit and hospitalization during a period of time. So the first cases entered in March 2020, and we were closing the research on the summer of 2021. So we make a lot of alliance with memorandums of understanding and legal processes with different health clinics and hospitals in Puerto Rico in order to obtain information about the number of emergency room visits and hospitalizations. And in the other part, we were, with that information, we wanted also to analyze the severity of the symptom by requesting the medical records of a couple of patients that were hospitalized during that period. In the other side, we also include excess mortality. And we started analyzing what is the interaction and how the Saharan dust could be exacerbating the causes for mortality in Puerto Rico, and if it was visible or not. Okay. So this is a graphic showing what happened. When we started thinking on the relationship and the interaction between COVID-19 and Saharan dust event, we were not thinking on Godzilla, because we create this idea somewhere in the spring of 2020, when the first cases of COVID arrived, and we submit the supplemental rapid response to NASA in order to capture this, to do this, and to include COVID-19, right? But we were not expecting the Godzilla dust event. And the Godzilla dust event marked a record for the Caribbean region in terms of aerosol arriving to our region. And as you can see here with the lines, we are seeing aerosols in the patterns in the region, and in the bars, we are seeing the number of cases and hospitalizations that occur with COVID-19. This graphic is not pretending to say this is not causality. We are not saying that after Godzilla dust event, the cases increase due to Godzilla dust event, but this is what happened, okay? After we received Godzilla, the cases also started to increase. Again, I'm not saying that the Godzilla dust event is the responsible of these numbers increasing in hospitalization and emergency room visit for COVID-19, but I will show you a couple of more numbers. So Godzilla dust event marked a record for a couple of, in the 4 places that we are providing information with our tachometers for the agencies. And as it created an unhealthy condition for almost 3 days in the 4 regions of Puerto Rico. Visibility in Puerto Rico could be like 15 to 18 nautical miles in a normal day. But it gets decreased by 3 nautical miles. As you can see here, for example, in the left side, these are pictures taken 1 day before a Godzilla arriving to the Caribbean. And on top of it, you are seeing, this is in the north side, looking at the airport of Puerto Rico, and you're seeing the cloud cover that is almost impossible to see the ocean from this side. In the other side, we're seeing the southwest of Puerto Rico in Guanica Bay, in the same 1 day before Godzilla, on top of it, and during Godzilla dust event. Both of them 9 a.m. in the morning. And as you can see, visibility is completely different, okay? And unhealthy condition lasted for 3 days in Puerto Rico. So when we were dealing with the qualitative information, we talk, most of the people that we were talking about were females, okay? So apparently females were more likely to participate in this kind of studies. But also we noticed that females were apparently with the doctors. We find out that apparently females were more susceptible to Saharan dust after being diagnosed with COVID-19. So probably these groups were not affected before with Saharan dust, but then being affected after COVID-19, apparently the consequences are so severe that nowadays they're actually susceptible to Saharan dust. Another thing that we identified with the qualitative information is that the participants that had COVID-19 patients and another pre-existing health condition, so comorbidities are very important in this analysis, are more likely to be affected by the Saharan dust than those patients that were suffering from COVID-19. And if we can say this, they were in a healthier conditions than others that have pre-existing health conditions, obesity, diabetes, pre-existing cardiovascular diseases, and all of the others components, okay? We also did a survey, and actually we received also 1,500 participants. Again, most of them were females. 82% of the participants that participate in this survey, 1,500 participants. It's a lot of people participating when we have an island of 3.2 million. The most interesting thing is that 65% of them that participate had a history of at least one chronic conditions, and most of them reported that that chronic condition was asthma, almost half of the participants, right? And 90% of them indicate us that African dust and the Saharan dust were affecting the health status of not only themselves, but also their family members. However, only 12% reported that they needed to seek for medical attention during the Saharan dust event. So that gives you an idea that if you're only looking for hospital admissions and emergency room visits, you might be receiving a misreport or underestimating the people that are actually getting affected, but with mild symptoms, not necessarily severe enough to seek for medical attentions. So that doesn't mean that the people are not getting affected. That only means that the people are getting affected, but not severe enough to search for medical attention. Okay. Obviously, individuals with comorbidity were most likely to search for medical services during the Saharan dust event than those that doesn't have it. Over 57% reported that the mild symptoms were, for example, causing postnasal drip, cough, red and itchy eyes. The usual suspect, right? When we're talking about this kind of irritation dust. For the public health data and the medical records, we ask and we request with the hospital that we made memorandums of understanding and the legal processes, different kind of conditions using the International Code of Diseases. Obviously, the first one that we were interested was COVID-19, but also the different comorbidities, because COVID-19 was not only there alone by itself, but it was also interacting with other pre-existing health conditions in these patients. One of the reasons why they were admitted in hospitals. And in terms of the database, a lot of information from air quality ground-based stations and also from satellites in terms of aerosol receiving. This is a graphic only showing the behavior and the patterns and the seasonal pattern that happen and occur with the hospital admissions and emergency room visits in Puerto Rico during the March or spring 2020 and the spring 2021. And as you can see, all respiratory causes decrease during at the first beginning of summer, and then all of a sudden, all of them started to increase. And we're using one of the main hospital centers in Puerto Rico. If you divide all the respiratory causes and take it under consideration, COVID or without COVID, you can see that the patterns are pretty much similar. During the summer, there was a huge increase in terms of hospital admissions due to respiratory causes, and then it decreased during the falls and autumns, increasing again during the winter. Most likely during the winter because of the seasonal viruses like flu that affect the respiratory system. Obviously, this graphic is not necessarily considering all of the other behavioral risk factors that need to be considered when we're talking about hospital admission, pre-existing health conditions, exposure, and all of those kind of things. It's only showing you a pattern at what happened with the respiratory causes in Puerto Rico during the 2020 and 2021 in some specific hospital. We have over 2,000 medical records that have been analyzed. In terms of the emergency room visit and hospital admissions, most of the people that we receive were males. So as different of the surveys and the qualitative information that we're using, in this case, analyzing with raw secondary data, most of them are males. And the vast majority were people that have in the age group of 41 and 65, the people that are getting hospitalized in Puerto Rico. And again, as I mentioned, this is the pattern that we observed. The Godzilla entered in June during the summer of 2020. With the statistical analysis with this information and with the mortality, what do we have, for example? So we have 9 different environmental variables that are being analyzed for Puerto Rico. We developed 18 environmental indices, and we retrieve most of this data, we retrieve it from satellite sensors. So in terms of mortality, what do we observe? For example, mortality tends to be higher in Puerto Rico during the winter season. We still don't know why. Scientists don't know why, but it is what it is, right? That's the seasonality of mortality in Puerto Rico. But we do have two major peaks that change everything during the past 5 years in Puerto Rico. We're using daily data for mortality island-wide. So we are seeing here that during the autumn of 2017, we have an excess mortality of almost over 9,000 people, right, in Puerto Rico. And why that happened? Because for most of you that are not aware, we suffered one of the most catastrophic hurricane seasons in 2017, and it was a lot of excess mortality in the aftermath of Hurricane Maria and Hurricane Irma in Puerto Rico, and it marking a record for mortality for the last 5 years. And if you continue searching information, then you will see that all of a sudden, it's not, again, the winter, but in 2020 is what the summer of 2020, which is weird, again, because during the summer of 2020, obviously, it was when the first, well, it was not during the first cases, but the first cases started in March, but it was when the virus started to spread island-wide, and also we received the Godzilla dust event. Again, I'm not saying yet that this is related with it. I'll be showing a couple of statistical analysis and results for you to better understand, okay? But again, summer of 2020 is marking another record for excess mortality in Puerto Rico for in considering the last 5 years, okay? So as preliminary results, we started analyzing mortality with days with dust and days without dust, and we actually observed that it was an increase in mortality between 2015 and 2017. We wanted to distinguish the difference before Maria and after Maria. And again, Maria was a powerful hurricane that occurred during the hurricane season in 2017. We eliminate flu causes and flu because flu is a vital, it has a very seasonal pattern in Puerto Rico, and it is tied to the winter season. And as I mentioned before, during the winter is when we receive the less amount of aerosols coming from Africa. So our main season is during the summer. So that's why one of the reasons that we eliminate flu, because it has a marked seasonality and it can change all of the statistics at the beginning, right? So after that, we say, okay, so let's analyze the full database that we have, daily data, over 20,000 data for mortality. And what do we have? We observed that actually the excess mortality due to COVID-19, it was associated to, it could be associated in somehow with extreme temperatures in some cases. For example, we were using the Universal Thermal Climate Index, which is an index that can be, that it was retrieved from Sentinel in collaboration with the European Union. We also observed that other kinds of natural sources of air pollution, like fungal spores, for example, were also associated with the mortality with COVID-19 in Puerto Rico. Also, ischemic heart disease is associated with aerosols arriving to Puerto Rico. So meaning that the combination with COVID-19, having a pre-existing health conditions, and the aerosol is most likely associated to an increase in mortality in Puerto Rico. Why ischemic heart disease? As I mentioned, we have been working with almost 19 different organizations. And one of the things that we bring into the discussion with the physicians, because I'm not a physician, is that it makes a lot of sense, because when air pollution get deteriorated, the lungs need to do a lot of effort to oxygen all of the body. And one of the major pumps to oxygen the body is not only the lungs, but also your heart. When your heart is doing a lot of effort, you might also, and if you have a pre-existing health conditions with cardiovascular diseases, such as with cardiovascular, then you are most likely to die because of heart diseases than just for COVID, right? So the combination of different things might be increasing the mortality in Puerto Rico. These are preliminary results. We adjust this for age and year, and still there is a result that is statistically significant using the Poisson model, assuming all of the observations. So this is a little bit shocking, obviously, but that means that we need to consider all of the other things. As I mentioned at the beginning, we're working with mortality, with the main results that we have, and the most statistically significant result that we have are mortality, because that's the best database that we have in Puerto Rico. We don't have a public database for emergency room visits and hospitalizations, meaning that we are really having a very limited information of what is happening, because we are making alliances with a couple of hospitals, but it's very difficult to obtain that kind of information island-wide. But in the epidemiology context, mortality is only the tip of the iceberg. So meaning that it's well accepted, and you can make an assumption that if you are even able to identify that there is a relationship between one environmental factor or one stressor that is actually increasing mortality, then it can be assumed that also other people that are under that umbrella are getting affected in a different dimension, in a different degree, probably with mild symptoms, but they're also getting affected. Okay, that's the principle and the assumption in epidemiology, right? So as consideration, so mortality, as I mentioned, is always the tip of the iceberg, but we do have a strong evidence that is suggesting that in some cases, some cause-specific mortalities are increasing due to aerosol arrival to the Caribbean, also associated with temperature, and COVID-19 patients are being affected in some cases as well. However, we do have a couple of other remaining questions that we need to continue working on that, on identifying the vulnerable patient populations, the underlying mechanisms of actions, and the regional variations on both of the environmental components, but also the health effects. We need to continue working on that to have a better explanation. These are preliminary findings that we have. So we strongly believe that this early warning system are being useful, at least for the decision makers, to start working, issuing warnings and advisories to the general public to help them to be better prepared when this aerosol dust clouds are arriving to Puerto Rico. And that's it. I don't know if there are comments or questions. Thank you so much for listening and for being here.
Well, thank you to you, Pablo. It was very interesting. I know very well that developing a warning advisory system is something very complicated. So congratulations. I think that this will be very useful for you. And yes, we have a couple of questions. Maybe you have explained this, or you can comment more about this. Both of them are coming from Daniel Melendez. The first one would be, is there data on fatalities or emergency room visits associated with dust severity, and at what resolution, island-wide or county, etc.?
Perfect, thank you. That question is pretty good. Our idea was to have the information distributed especially per region. Puerto Rico is divided in 8 different regions for the Department of Health. Our main idea was to use that information and use those regions to provide the resolution for the Department of Health. But the limitation is that we don't have that information available from the hospitals and from the clinics to do that kind of analysis. So what we're doing is island-wide. Okay. Another limitation is that if you're using satellite information all over the earth, when you have different backgrounds, it might change the signal that you are receiving in the sensors. So actually, the retrieval and the aerosol optical depth that we're using is based on the information retrieved near the coastline, close to the cities, to the main cities of Puerto Rico. In the north side, near the capital, in the south side, near one of the biggest cities of Puerto Rico, in the west, and in the east side. But the retrieval is mainly near the coast. to have an homogeneous background and body to avoid any misinformation in the signal that we're retrieving from the sensors.
Okay, thank you. And the second one is there a bias in the respondents in terms of their health profile as compared to the general population?
Yes, of course. Actually, I think, sorry if I didn't mention, yes, when we were doing the surveys, yes, there is a bias. Only 82% of the participants were females. So that's huge when you're considering in Puerto Rico that it is almost 50-50, 48, 52, something like that, okay? So yes, it is biased. But the most important thing to take out of this surveys again, are not necessarily, it's providing you knowledge, patient concerns, the barriers and everything, right? So one of the most important things to take out from this surveys is that actually, apparently, women are more concerned in this topic because also there was a voluntary interest for you to participate. So if you are not interested in participate, that's another thing, right? So actually, yes, the population in Puerto Rico, demography is split in 48-52, females and males, having 82% of the participants being females in the surveys. It is a bias.
Okay, next question is coming from Damian Barantiev. And well, he's asking if you have a publication on these results. I think you are working on it, right?
Exactly. We are working on it. It took with the, for example, we're still analyzing the severity of the symptom that I didn't mention anything about it from the medical records because it's been very complicated to obtain that information in Puerto Rico. We only have numbers, but beyond numbers, we want to have more than that. We would like to understand the adherence of the treatment. We would like to understand the severity of the symptoms, the number of days that they stayed in the hospital, right? Not only having a few numbers as I show in my graphic. We believe that that's not enough. We need to provide more information. And we're actually doing that right now. It took us longer than we expected because of the situation with the legal processes with the hospitals. But actually, we are drafting the first couple of manuscripts to publish this information.
Okay, thank you. And the last one that I have is from Danshul too. And do you also find relationship between mortality and PM10? I suppose you have been speaking about PM2.5.
Yeah, PM2.5. We are not analyzing in that case of mortality PM10, but it might be interested also to include it in the equation to see if it is modifying the outcome. It can be considered. Mm-hmm.
Okay, and we have another one. Satellite data have uncertainty, and so how did deal with this uncertainty while linking more mortality?
Uncertainty while dealing with mortality?
Yeah, well, the satellite, you have data from the satellites, you have uncertainty, so how implement this uncertainty or with the relationship between mortality and this uncertainty?
Well, that's a great question. Satellite information have a lot of limitations, but they are also powerful in terms that they are providing you information that can be used as a proxy, right? Again, this is not providing you concentrations of air pollution at the ground level, for example. It's not providing you very fine or coarse spatial resolution in the case of Puerto Rico because we are very small as also, and it's not also providing you a very fine temporal resolution. So actually, yes, there is a lot of limitation when using this information, but we strongly believe that are providing you enough information to let the people know what is happening to take precautionary measures, right? So that's the most important thing when we're developing early warning system. We don't actually need to have the most detailed information, but if we're able to minimize the negative impacts on public health by using this kind of visualization tools, that's a win. That's a win, actually. if you're able to let them know that these dust clouds are arriving and you are already identified as a scientific group and you might be, your symptoms might be exacerbated, that's a win. Okay, you're winning with that already. But again, there are a lot of limitations, and that's why one of the reasons, for example, NASA is going to be launching 2 more sensors, Maya and Tempo, in the next couple of years. Tempo is planned to be launched during this year, and Maya very soon as well. So yes, there's a lot of things that need to be improved.
Okay, thank you. We don't have any more questions, I think. Maybe somebody from the audience wants to speak up and ask you directly. In the meantime, I have a question. Well, it's just out of curiosity maybe, but this interest for having a warning advisory system is coming from who? I mean, from the scientist community, or maybe from the common public, or politicians, maybe? I don't know.
No. It didn't come from politicians. That's a good question. It was something that it was born discussing with scientists and with practitioners in collaboration with the National Weather Service. For example, I was able also to co-design the early warning system for heat back in 2012 with the National Weather Service. And so the National Weather Service is looking to provide more information considering the impacts also in public health. Even though if they're not going to be issuing warnings for health components or context, but they're looking to improve those warnings that they have. Heat is the #1 cause of mortality when we're talking about climate or weather conditions and public health, and the other ones is air pollution. So anthropogenic air pollution is not part of the mandate in the National Weather Service, but they do actually monitoring Saharan dust. So that was a leverage. So we say, okay, so let's work on that with scientists, practitioners, and let's say that's something that we must address in Puerto Rico, because it sounds like we need that warning here. And actually, the data is showing, is suggesting that, yes, it's much needed.
Okay, thank you very much. So I don't know if there is no more questions. Well, it's time, I think. So thank you again, Paulo. It was very interesting. So yeah, thank you very much.
Thank you, Ernest, and thank you everybody for being here and for listening. Have a nice day. Good afternoon.
Good afternoon. I think that we have time to announce the next webinar. It will be in a month. Yeah, exactly in a month. So we will have Angela Benedetti, and she will speak about advances on dust seasonal predictions. So well, don't miss it. It will be also very interesting. So well, thank you for attending this webinar, and good afternoon to everybody. Have a nice day.